good afternoon. I want to thank everyone for being here this afternoon. We are here today because after 2 decade-long wars, our veterans and their families are facing many, many difficult challenges. Physical injuries and pain, the scars of combat, both seen and unseen, PTSD, mental illnesses, and addiction. Unfortunately, I believe that the VA's prescribing practices and over-reliance on opioids has resulted in getting our veterans hooked rather than getting them help. Families like the Simcakoski family, who we are so grateful to have here with us today, have a story to tell, and that story needs to be heard. It's a tragic story of loss. The loss of a son, husband, a father. It's also the story of a sacred trust that we should have with our veterans and our veterans' families. It's a story of how that trust has been broken. Today, I'm proud to stand with them, inspired by them, to fix what has been broken. And that's why, with the support of the Simcakoski family and the veterans and health organizations that are represented here today, I am honored to introduce the bipartisan Jason Simcakoski Memorial Opioid Safety Act. This bipartisan bill takes a common sense approach to address the problems of overprescribing practices at the VA and provide safer and more effective pain management services to our nation's veterans. This bipartisan bill will give veterans and their families a stronger voice in their care by strengthening opioid prescribing guidelines and enhancing provider education and training. It also works to improve coordination and communication throughout the VA and puts in place stronger oversight and accountability for the quality of care we are providing to our veterans. Our goal is simple: put these bipartisan reforms in place to prevent tragedies like Jason's from ever occurring to other veterans and to other veterans' families. So I would like to thank the veterans and healthcare organizations that are with us here today. They played a critical role in making this legislation a reality. Your insight, your expertise, your experience, your support has been truly invaluable. And I'd also like to thank my bipartisan co-sponsors of the measure, Senators Capito, Blumenthal, Brown, Hirono, Johnson, Kane, Manchin, Markey, Moran, Murray, Sanders, and Tester for signing on, all as original co-sponsors of this bipartisan effort. And finally, I'd like to thank Jason's family for traveling from Wisconsin to be here today. Marv and Linda, Heather, and Anaya, your courage and determination to honor Jason's memory has been an inspiration to me. And so it has also to many others across the state of Wisconsin and frankly across the country. Through your advocacy, you are helping other veterans and their families and inspiring others to take action and join in this action. In America, we have a shared responsibility to serve those who have served us. And today, we live up to that responsibility and commit ourselves to taking action. It is my honor to now introduce all of you to Jason's dad, Marv Simcakoski.
Thank you, Senator Baldwin. Yeah, I'm just happy that I'm here today speaking on my son's behalf. And I just want to say I hope this bill passes. I know my son would be proud to have this this bill named after him. And you know, And my son went through a lot of struggles, and I worked with him over the last 4.5 years trying to deal with the problems in the VA and the doctors. And, you know, it's been a tough 4.5 years. My son, you know, now after he passed away, I look back and I think, you know, he really didn't have a chance. The way the system was, and if something isn't done to correct it, you know, there's going to be a lot of other veterans out there that run into the same problem as Jason did. And, you know, I don't know why the VA had the philosophy of, at least in the VA in Toma, of over-medication as the answer to success to a patient, because they were absolutely wrong. And in my son's case, you know, I didn't see any improvement from the time he got in there to the time he got out. In fact, I saw his self deteriorate instead of getting better. You know, my son would go through 28-day programs. I'd pick him up. His voice was slurry. He couldn't talk good. And they'd say, hey, he did a good job. He's fine to go. Well, you know, he didn't even know what he was going through the 28 days. You know, and there's just a lot of things that need to be fixed at the VA. And I can't speak for the other VAs, but I can speak for my son from the VA in Toma. And, you know, it's, you know, I just saw, you know, too much medication, too much. I mean, you know, my son had an addiction with pain meds, and yet they put my son back on pain meds, and they sent him home with 50-some and told him to take them regularly. You know, I couldn't understand why anybody with a pain med addiction problem a doctor would even think about putting him on pain meds, which he never needed in the first place. You know, they had him on so many different meds. They had him on meds to Adderall and things to go, and then sleeping pills and relaxers at night. You know, his weight went up from 180 to 254, I think, the day he died. He was miserable. You know, he told me time and time again, he said, Dad, I'm not happy with this life. I don't want to have this problem. And, you know, the addiction problem wasn't his likings. I mean, he told his daughter, you know, that, you know, not to take any of these type of meds because they're only going to do you harm. And, you know, people, I know there's a few veterans that complained and said, well, you know, you're taking away our meds and that. My reply is, no, I'm saving your life. Because the answer to over-medication is death. And eventually, it's going to happen to other veterans just like it happened to my son. And, you know, I think with this bill and with all the good work that Senator Baldwin and her staff has done, you know, this has given other veterans a chance of life. And we need this bad. And I just hope that, you know, everybody sees that they have a chance to do something good here today and make this happen. Thank you.
Hi, thank you, Senator Baldwin, for having us here. This bill is largely important, I know, to myself and to my daughter, to our entire family, and also to every veteran out there. We spent years and years with hope that we would watch Jason's health improve when he was seeking treatment at the VA. I don't want people to ever give up hope. I want them to know that there are people, there are leaders in this country that are listening, that when they hear their cries for help, they're going to put action into place. You know, we've spent years and years watching Jason die a slow, painful, miserable death. It's torture. When you watch someone start out on these medications, you don't ever see them, they don't ever tend to get off of them. You watch them go through the side effects of the amount of pain medication that Jason was on. I watched a guy that was so full of life, so passionate. He won an Ironman when he was in the military. He had his colonel call his dad and tell him when he was in the military that they wanted to put him through officers candidate school. So you're not talking about just a Marine, you're talking about an exemplary Marine that lost his life for a senseless reason. I watched him go from this guy that was incredible to someone that couldn't even get out of bed, that's sleeping 23 hours a day. And I know that that's not just his story. I want to honor the people that have lost their lives already due to the over-medication, the veterans that I hear and read about. This wasn't just Jason. They've lost their lives, and I think we need to speak up for them as well as the future veterans. It's not going to stop. I don't want to find any of us in another room again or watching a television headline saying that somebody else lost their life due to over-medication. We need to be proactive and not reactive, and we need to stop it because it's an epidemic and it's in a crisis across the nation. And for every veteran, every individual that gets hooked on these kind of medications, tens and hundreds of thousands of people around them are impacted because their loved ones feel guilty and helpless. You don't know how to help them. You have hope. And it's senseless. We have an opportunity right now to pass this bill, and I want to thank every group and every member of Congress that has already joined this committee. I think that there will be families across the nation that are so thankful for your backing of this because as a family member you feel helpless. You have a doctor saying this is okay, this is what you're supposed to take. Let alone you have families saying why are you giving this to that patient? It's so difficult to understand why it would be okay to give someone 14, 15, 16, some cases 20 medications. To read the white papers that were published saying that 56% of prescriptions were refilled early. There's just so many senseless things that have happened, and we have an opportunity now to stop that. So I just want to say thank you to everyone, and hope this bill passes.
Good morning. My name is Carlos Fuentes of the VFW. On behalf of the men and women of the VFW, we are proud to offer our strong endorsement of the Jason Simcakoski Memorial Opioid Safety Act and thank Senator Baldwin for her leadership in bringing it forward. I would like to also thank Heather and Mark for their courage to be here today and for your advocacy on this important issue. The VFW stands with you and we will not rest until this bill becomes law. Too often, the VFW hears stories of veterans who have been prescribed high doses of ineffective medication, and to treat and manage chronic pain and mental health conditions. Countless veterans and families have experienced firsthand the dangers of pharmacotherapy. Many of these medications, if incorrectly prescribed, have been proven to render veterans incapable of interacting with their loved ones and even contemplate suicide. Veterans who struggle with mental health conditions and chronic pain have earned and deserve a VA healthcare system that provides them the best healthcare available in a timely manner. This bill includes much needed reforms to ensure VA's clinical practice guidelines for managing pain are appropriate. It includes compliance mechanisms such as the pain management boards to ensure such guidelines are correctly carried out. This bill also includes important changes to the VA healthcare system. For example, establishing an office of patient advocacy, which will report directly to the Undersecretary of Health, to correct what we've heard from countless veterans, that their patient advocates are ineffective or choose to protect VA healthcare leadership instead of advocating for veterans. This bill will ensure that patient advocates have the ability to address concerns without fearing reprisal. This bill would make other significant improvements to the way the healthcare veterans receive from the Department of Veterans Affairs, and we urge its swift passage. I'd like to turn now to my colleague Ian from the American Legion.
My name is Ian DePlank. I'm the Legislative Director of the American Legion. I would like to thank Senator Baldwin for her leadership in this area, particularly with the Toma crisis. As we're speaking right now, there's an American Legion team in Toma that has been working all week, half a dozen members. of our leadership and our staff, national staff, that are working to try and improve the relationship between the VA and the community in that area and to study this problem. I can't do any better than the family has done today in terms of illustrating the impact of how this affects veterans. The American Legion did a study last year, a survey of veterans going through traumatic brain injury and post-traumatic stress disorder, and staggering numbers of them were on cocktails of 10 or more medications. Anytime you increase the number of medications to that level, there's more chances of bad interactions, there's more chances of complications and confusions, but this is kind of a reality that we're facing now. Soldiers who previously would never have come home from foreign battlefields are coming back now, and they're coming back with complex injuries, and they require treatment. And we can't just say no treatment, and you can't just say no medication. We need updated clinical guidelines on how to treat these veterans, and this legislation will provide that. It will look at alternative and complementary medicines, other ways of going around this problem so that we can address the problems for veterans. I think this is an absolutely vital piece of legislation. I think it addresses the modern needs of veterans who are coming back, and also veterans who have fought in many conflicts before who still struggle with these problems. So the American Legion urges the passage of this legislation. We thank Senator Baldwin for her leadership on this. And I'd like to introduce Dr. Gerald Marty from the American Society of Addiction Medicine to speak. Thank you.
Thank you. Good afternoon. My name is Dr. Gerald Marty. I'm here today on behalf of the American Society of Addiction Medicine, our nation's oldest and largest organization of physicians specializing in the treatment of addiction. We are pleased to offer our strong support for the Jason Simcakoski Memorial Opioid Safety Act and want to thank Senators Baldwin and Capito for their bipartisan leadership on this critically important issue affecting our nation, and in particular, our veterans. As a practicing addiction specialist, I have seen the devastations that this disease can cause, and my colleagues and I know far too many families like the Simcakoskis who have lost loved ones, many at the time, the prime of their life. Unfortunately, the epidemic of opioid addiction we are now facing has in many ways been spurred and exacerbated by our own healthcare system. Healthcare providers often don't receive adequate training in pain management or the identification and treatment of substance use disorders. Because of this, they too often rely on opioid therapy when other options are available to treat pain, and we too often miss the signs and symptoms of addiction or simply don't know how to help patients with addiction. ASAM has long been a supporter of mandatory education for prescribers of controlled substances and offers several educational opportunities for healthcare providers to learn more about safe opioid prescribing. I am one of several ASAM faculty members who teach an FDA-mandated risk evaluation and mitigation strategy, so-called REMS course, for the safe use of extended release and long-acting opioids. And I have seen firsthand the difference this education can make in patient care. Importantly, this course also emphasizes the prevention of addiction and diversion and the identification and treatment of substance use disorders, educational components we are pleased to see included in this legislation. As we all know, the issues involving opioids that the VA is struggling with are the same issues that our nation is facing at large. We hope that the lessons learned and the improvements made to veterans' care through the Jason Simcakoski Memorial Opioid Safety Act can eventually be translated to a broader population. Our veterans have given so much in service to our country, and they deserve the best health care we can offer in return. That includes ensuring our brave men and women have access to high-quality, safe, and compassionate pain management and addiction treatment, and this legislation will make that happen. ASAM would like to thank Senators Baldwin and Capito again and offer our condolences to the Simcakoski family. We look forward to working with the senators and other allies to ensure the swift passage of this important bill. Thank you.
Hi, my name is Adrian Adezato. I'm actually the Assistant National Legislative Director for Disabled American Veterans. The DAV is about a 1.3 million member organization. Our members are service injured veterans who served in wartime. And I can tell you that this bill it hits pretty close to home. The previous speakers have talked about the merits of this bill, have talked about the importance of this bill. I too would like to thank Senator Baldwin and Senator Capito for introducing this bill. And I deeply appreciate the Simcakoski's courage, I think is the best word. They are putting a face on what is effectively being described as a public health epidemic. And this hits close home to our members because most of them suffer from complex severe injuries. And their complaint about VA's pain management policy is that it lacks humanity. And I think that's what this bill, in all its forms and provisions, does. It puts back the humanity in treating veterans who deserve so much better, the kind of care that they need to get back into the civilian world and be an active member of the society. I just hope that this Congress will turn this tragedy into triumph and give Jason the credit and the respect he so very deeply deserves. Thank you. I believe it's Senator Baldwin now will take the podium. Oh, I'm sorry, one more.
Sure. Good afternoon. My name is John Rowan. I'm the National President of Vietnam Veterans of America. First, let me express my condolences to Jason's family, and we're so sorry for your loss and that had to occur this way. As Vietnam Veterans of America, it's not surprising that we have this issue today before us. It seems that many of the issues that we dealt with 40 and 30 years ago are coming back to haunt us one more time because of the new wars and the large number of folks who've gone through them. We want to thank Senator Baldwin and her colleagues for putting in this piece of legislation. The VA, unfortunately, has always had a problem with over-medication. We can tell you lots of stories back in our period of time when they didn't know what to do with PTSD and they didn't know what to do with a lot of other things. And one of the quick things was, well, let's give them some Thorazine or whatever product they had at the time. Unfortunately, today with modern medicine, we have many more products. And they come with all kinds of problems. And so it's so important that we need to be able to get them all squared away. This is not to say that people don't need pain medication on occasions and need treatment, but there's lots of ways of doing that. I'm not a doctor. Other people can tell you much more about that than I can. I just thank the Senator for getting this bill out there, and hopefully we'll get it passed very quickly. And hopefully it'll help spur the VA to change their internal attitudes on this issue. Thank you.
I'd be happy to take any questions, as I think our organizational representatives will also. I will just note that in 20 minutes, the Senate Veterans Affairs Committee will be convening to hold a hearing on a host of measures, mostly focusing on the health care of our veterans, and this bill will be one of them, and so we will have to depart in order to attend that. But are there any questions?
Has the VA, to your mind, acknowledged that there's a general problem of over-medication, over-prescribing? Have they communicated that to you, and have they had any response to this legislation?
Well, the VA will send a representative to testify at the hearing, and they certainly will provide comments. But before we look forward to those, let me be clear that I shared early drafts of this legislation with the VA to allow their insights and input. And I would say, in part, in the course of their investigation, their clinical investigation into what was happening at the Toma VA, some of the things that we are building upon in this legislation have been initiated. I'll give you one example. There is an opioid therapy risk reporting tool that has been created. However, we feel very strongly that it needs to provide real-time data and the ability to analyze that data in real time. So if there are warning signs, action can be taken immediately rather than with a lag time of weeks or months. That'd be one example, but I think the fact that there are working on a couple of these provisions already would represent, and I don't want to speak for them, but would represent an acknowledgement that a lot of work needs to be done. I don't know if anyone else.
Just
Yes.
to follow up on that. Didn't the VA IG release a lot of documents related to their investigation earlier this month? And they said that they couldn't substantiate a lot of these claims of overprescription.
I don't know that that's a fair reading of there's a lot of documents that have come out recently. I think that we have seen across the system certainly higher rates of prescription of these powerful and highly addictive drugs compared to compared to prescribing practices outside the VA. Now, there may be all sorts of reasons for that, but there are a number of reasons to be concerned, and I don't think that while there may be disagreement over specific cases, I don't think that there's a disagreement with the general view that there's over-reliance. I would amplify what was said earlier also about the desperate need to provide greater resources and attention to complementary and alternative ways of treating and managing chronic pain. It's real. We're not going to deny that, but I think access to it and having the best science and the best evidence so that our veterans get the pain management treatment that they deserve and have earned is critical, and it's a piece of this legislation.
One more
Please.
note to add to that, and I'd like to tie in also to something that Jason's father mentioned about his son talking about not feeling right. That's a common refrain we've had from discussing this with a lot of veterans, and I know the reports that you're talking about. And we still run into, and we ran into this a lot as the American Legion was looking into post-traumatic stress disorder and traumatic brain injury, where they would have large lists of medications. They were on 10 or more medications. And the veterans would express confusion over it. They weren't always sure what they were on for what purposes. So it's possible that with a large number of medications, there may be a very good clinical reason for those veterans to be on those, but there don't seem to be very good established guidelines for why those are necessary and how that's being explained to the veteran. And if the veteran is confused about their medications, or if the veteran doesn't have a strong understanding of that, that's something that needs to be improved upon. And I think what's strong in the legislation is it talks about establishing proper clinical guidelines. Medications in and of themselves are tools that not necessarily good, not necessarily bad. You want to make sure you're using the right tools in the right situations. And there are other tools that are available in the toolboxes out there, some of the complementary and alternative things that might work better for particular veterans or for veterans when they have other conditions that may be exacerbating or confusing certain situations. And that's why establishing good, strong clinical guidelines, I think, is important.
Senator, I know there's part of the bill that addresses patient advocates
Yes.
and education. I know, Mar, one of the issues that you had was you sat down with a patient advocate and Jason's doctor and raised concerns, and obviously nothing came of it. How will this change that dynamic?
Yeah, these provisions are a recognition that also, beyond what your question anticipates, is that treatment works better when there's a partnership between patient and their medical providers. And frankly, when there's family involved, if it's a whole team approach, that everybody understands the course of treatment, the desired results, we're on the same page, and with family members providing their loving support for treatment and healing. When either the patient or the family member's voice is discounted, disrespected, disregarded, that team approach breaks down very quickly. And that was a sort of compelling part of the Simcakoski family's story and experience. And we believe that a number of modifications to assure that patient advocacy in the VA is truly patient advocacy, and that there aren't conflicts of interest, frankly, of that patient advocate, of who they report to, and you know, we can't. I think we can't tolerate any type of conflict of interest. So there's a number of measures in the bill really aimed at respecting the voice of the patient and their family.
Last question?
Yes.
Ma'am, this issue was reported on multi-drug toxicity and people with accidental overdoses since at least 2009, 2008. What do you think the strongest part of your legislation is, and that's going to address that real problem that's now been around for 6, 7, 8 years?
Well, you know, there's obviously a number of points of emphasis, and we've already talked a little bit about patient advocacy issues and alternative and complementary treatments for people who are dealing with chronic or acute pain. But I think the sort of some of the central provisions with regard to prescribing and the VA's over-reliance on these powerful and addictive medicines is to have the latest science, the latest evidence, updating their guidelines, making those more strict, and then driving them out through the provider community within the VA through strong education and training. Because it's one thing to update a guideline document. It's another thing to make sure that all providers are well versed, and there's different levels of training depending on whether you are actually authorized to prescribe opioids. This would include also interactions between opioids and, say, benzodiazepines. It would also update guidelines on treating patients who do not present necessarily with physical pain, as was the case with Jason, who was nevertheless being treated with these powerfully addictive drugs. There is a demand that there be coordination with the Department of Defense, as well as the Department of Health and Human Services, particularly the CDC, which is sort of the go-to for the latest standards based on guidelines, that is, based on the research that's being done. Thank you all so much for being here. Thank you.
Yeah. Yeah.
I